AstraZeneca, the pharmaceutical giant that rejected a takeover from Pfizer more than a decade ago, is now in talks about a tie-up of its own, and this one could be even bigger. People familiar with the matter say the British drugmaker has held discussions with the American company Bristol Myers Squibb in recent months about combining the two businesses in a deal that would value the combined group at nearly $400 billion. The talks could produce an agreement soon, but they could also stall or collapse entirely, and nothing has been signed. To understand the scale here, look at where each company stands today. AstraZeneca is the second most valuable listed company in the United Kingdom, with a market value of roughly £196 billion. Bristol Myers Squibb is worth around $133 billion. Put those two together, and you get one of the largest pharmaceutical mergers ever attempted, a combination that would instantly become the fourth largest drugmaker in the world by market value. At the center of this is Sir Pascal Soriot, AstraZeneca's long-serving chief executive. Soriot is the same executive who, back in 2014, fought off a nearly £70 billion approach from Pfizer, a rejection that is now viewed as one of the defining moments of his tenure. Since then, he has built AstraZeneca into a genuine powerhouse in oncology. Bristol Myers Squibb also has a large cancer drug portfolio of its own, which is part of what makes this pairing make strategic sense, and part of what will make regulators take a very hard look at it.
This is Conference Hype. Stay with us, coverage continues.
A deal like this would deepen AstraZeneca's presence in the American market at a moment when that market already matters enormously to the company. AstraZeneca has set a target of $80 billion in revenue by 2030, up from $58.7 billion last year, and hitting that number depends heavily on the United States, where the company already earns close to half its sales. Soriot told reporters just last week that AstraZeneca does not need mergers and acquisitions to hit that 2030 target. But the company has also been actively signing licensing deals in China to strengthen its drug pipeline, and a deal of this size would dwarf anything AstraZeneca has done before, including its $39 billion purchase of the rare disease biotech Alexion in 2021, which is currently the largest acquisition in the company's history. For Bristol Myers Squibb, the calculus looks different. The company has been seen as something of an industry laggard since its $74 billion purchase of Celgene back in 2019 failed to deliver the returns it promised. On top of that, Bristol Myers Squibb is facing steep potential revenue losses in the coming years as several of its core drugs lose patent protection. A combination with AstraZeneca would give the company a much stronger platform heading into that period. This all comes with real political weight attached. AstraZeneca only just completed a direct listing in New York this past June, a move that was already seen as a blow to the London stock market. A merger that pulled the company even further toward the United States, potentially including a shift in where it is legally domiciled, would intensify fears in Britain about its biggest companies drifting away from home. Any cross-border deal of this size is also likely to face serious antitrust scrutiny on both sides of the Atlantic, given how much cancer drug overlap exists between the two companies. At the same time, this is happening against the backdrop of a Trump administration that has shown real openness to big deal-making, helping push overall American merger activity to levels close to record highs. Markets have already been reacting to the diverging fortunes of these two companies. Bristol Myers Squibb shares are up 21% since the start of the year, while AstraZeneca shares have actually fallen 8% over that same period. Whether or not these talks turn into an actual signed agreement, they signal that some of the biggest names in global pharmaceuticals are once again looking at consolidation as the path forward. And a deal of this size, if it happens, would reshape the entire landscape of the drug industry. That is the story of Big Pharma Merger Talks update. Add your perspective in the comments, share this story with a colleague, and subscribe for the next Conference Hype narrative.